Drugs are important to saving and improving public health. However, medicines are often not available because stocks run out or pharmaceuticals are not available due to a shortage of supplies. There is a relatively low availability of drugs in some developing countries, including Nigeria, and the implementation of a drug revolving fund policy should ensure the safe, quality, and affordable availability of drugs. These were the words of pharmacists and experts in the health sector during the 2023 Annual Scientific Conference on Drug Revolving Fund Policy in Nigeria, pathway to attaining sustainable drug availability in federal health institutions, organized by the West African Postgraduate College of Pharmacists.
I came here to see the challenges that has been bedeviling the scheme because I thought it was going down. It was going down. But I'm highly impressed with the elements mentioned by the keynote speaker. And it shows that the scheme is actually progressing because it has been elevated from just a mere DRF, giving the drugs under one roof, to drug management committees in most states of the Federation. And that is a policy thing. So it's a migration. The drugs revolving fund is an element of drug management unit of the hospitals, and it's working. In fact, other hospitals have migrated from just procurement of the drugs from manufacturers to actually manufacturing the drugs themselves. Like Kano State, I know they do that for sure. So the essence is that to make these drugs available under one roof to the patients as and when needed.
Permanent Secretary of the Federal Capital Territory Administration (FCTA), Adeshola Olushade, who was represented by the Director of Pharmaceutical Services (FCTA), said the institution of the DRF in various facilities is therefore the way to go in pursuing and instituting a sustainable health supply system for the healthcare sector in federal institutions.
My first advice would be to get enabling documents like the SOP, Standard Operating Procedures and Guidelines, and enabling national policies like the National Supply Chain Management Policy from the Federal Ministry of Health to guide them in the setting up of this DRF, Reform DRF, and the drug management agencies or their stores, as it may be. That will guide them to start aligning with that, and to give them a footing to also operate with by the tenets of that DRF. Because if they don't understand what the documents say and they are not operating according to that, they will go astray along the way.
The keynote speaker, pharmacist Mohammed Garba, who is the head of the pharmacy department at the University of Abuja Teaching Hospital, stressed the need for government to implement a Drug Revolving Policy Act, which would provide a legal framework for a robust funding policy in the country.
For it to be effective, honestly, there's need for members of National Assembly to come up with an act of parliament that will be able to guide all our health institutions, so that Nigerians will be able to now benefit. Universal health coverage will be a mirage so long as the drugs are not available. There's a popular saying by most NGOs: no product, no program. And most hospitals, like in the words of Professor Adeyo Lambo, this regional director of WHO, says that any hospital that lack drugs lack credibility and substance. So in other words, echoing his words, is drug is as important as anything. All the patient needed in the hospital, apart from clerking by the clinic, by the physician, next is medication. If the medication are not there, whatever the doctor must have done is useless.
The chairman of the conference, pharmacist Chinyere Osakwe, and the zonal coordinator, West African Postgraduate College of Pharmacists, Abubakar Danraka, called for strengthening and improved monitoring and evaluation mechanisms to ensure that the policy is effectively implemented.
We've moved from guidelines. Some people are still in the guidelines point, but those who have moved into the Act of Parliament, where there is a working document that has the backing of Parliament, even if it is the state parliament, with sanctions, that is the thing, and reward. Nobody does this without sanctions. So when an act of parliament comes with sanctions, then DRF will be respected, and The challenges we had when we were practicing depletion of the DRF account, not giving it a operational backing. Remember, it needs operational backing. Those things will now be a thing of the past.
The drug revolving fund is actually designed by government to solve the problem of unavailability of medicines in federal health institutions and across health institutions. But unfortunately, the non-implementation, due implementation of it had led us to out of stock syndrome, where we are not having drugs in public health organizations. Our advocacy is for call on federal government to do an act of parliament that will institutionalize the drug revolving fund so that there will be sanctions for those that don't comply, and by so doing, ultimately we are making drugs readily available to Nigerians at affordable, qualitative and effective means.
It is worthy to note that podium abstract presentations were delivered. The major highlight of the conference was a call on stakeholders and the government to recognize the pharmacist body in the health sector in order to encourage practitioners and make healthcare a heaven for all in Nigeria and Africa at large. Folonsho Adegoke, Core TV News, Abuja.